afternoon, everyone, and welcome to this session, Redefining Maternity Care Through Sustainable Supply Chains. My name is Josephine, and I'm the Perinatal Clinical Officer for Born Green Generation. Today, we have three wonderful presentations. The first two are clinical partners in the Born Green Generation initiative, and will be sharing their experiences of encouraging innovation with suppliers to support the ambition of reducing unnecessary plastics and mitigating exposure of harmful endocrine disrupting chemicals during the first 1,000 days. The third presentation explores service-based procurement as an alternative to product-based. Before introducing our great speakers, a couple of quick points from me. Please note that this session is being recorded and will be available on the page shortly after the session has ended. Please use the live chat tab in the panel to the right of your screen to add any comments, or the Q&A tab to send questions to our speakers. Where possible, please specify who your question is for, and we will aim to put them to the speakers at the end of this session. If we don't have time to answer the questions, then speakers are encouraged to answer them in the chat after the session. Otherwise, feel free to engage directly with any speakers or fellow attendees via their profiles. Now, our first presentation is pre-recorded with translation from Dominique Lecoux, Midwifery Coordinator and Born Green Generation Implementation Manager at the Centre Hospitalier Angoulême in France, where she has spearheaded changes for the health and safety of pregnant women and their babies.
Bonjour, je suis Dominique Lecoux, sage-femme coordinatrice à la maternité d'Angoulême. Aujourd'hui, je vais vous présenter les démarches entreprises pour concilier des soins de qualité destinés aux mères et aux nouveau-nés avec une gestion éco-responsable et durable. Nous avons notamment travaillé en concertation sur les chaînes d'approvisionnement et les relations avec les fournisseurs afin d'intégrer des pratiques respectueuses de l'environnement dans notre approche. Depuis 2015, la maternité d'Angoulême s'est engagée dans des pratiques éco-responsables comme le recyclage des mini-biberons en plastique, remplacés en 2022 par des modèles en verre. Cette initiative découle d'études sur les impacts des perturbateurs endocriniens présents dans le plastique, lesquels peuvent affecter le développement des nouveau-nés et entraîner des pathologies graves. L'engagement s'est concrétisé par l'obtention en 2020 du label Très haute qualité sociétale et environnementale, fruit d'une collaboration avec les fonctions support de l'hôpital. Pour sensibiliser les équipes et les parents, des formations sur la santé environnementale et des ateliers nesting ont été mis en place. Ces actions visent à réduire l'exposition aux polluants tout en améliorant la santé des femmes enceintes, des nouveau-nés et du personnel. Chaque démarche reflète une volonté durable de protéger la santé et l'environnement pour les générations futures. Pour mener à bien ces initiatives, il est essentiel d'intégrer les acteurs internes, notamment les équipes médicales et paramédicales, ainsi que les directions des services supports tels que le magasin, la blanchisserie, les services économiques, la gestion des achats, les services financiers, les services techniques, la restauration, la stérilisation, la pharmacie et l'hygiène. Ces entités, en collaboration avec les fournisseurs associés, assurent le fonctionnement optimal du service et du pôle femmes-mères-enfants. Afin de valoriser ces partenariats, une collaboration étroite avec le service communication est indispensable. La réussite de cette démarche repose sur une adhésion collective dépassant le cadre d'initiatives individuelles. Afin d'engager pleinement les équipes, les partenaires internes ainsi que les fournisseurs, une démarche de collaboration structurée a été mise en place visant à harmoniser les interactions entre les services de soins et les services supports, ce qui n'est pas forcément inné. Pour ce faire, nous avons été accompagnés par la société Primum Non Nocere, qui a établi un audit de pratique. Cette initiative a été soutenue financièrement par l'Agence régionale de santé de Nouvelle-Aquitaine. Pendant près de 2 ans, des réunions interdisciplinaires ont été organisées, permettant de partager les expertises et de co-construire des solutions durables. Des ateliers d'idéation sur l'éco-conception des soins ont été proposés aux équipes soignantes afin de définir les priorités sur les thématiques jugées essentielles pour ces dernières. Une fois ces axes prioritaires identifiés, des formations complémentaires ont été mises en œuvre. Par exemple, Le lavage écologique des sols avec l'utilisation de microfibres et d'eau pour lequel notre maternité a joué un rôle pilote dans la mise en place et le déploiement vers les autres services du pôle, pédiatrie et néonatologie. L'objectif à terme, en collaboration avec le service d'hygiène, est de généraliser cette pratique à l'ensemble de l'établissement. La néonatologie a été pilote pour la mise en place de la vapeur pour la désinfection des incubateurs et des berceaux. Des retours réguliers sont organisés entre l'encadrement, les équipes soignantes et les services supports pour évaluer et affiner les nouvelles pratiques. Cela a notamment permis d'optimiser les chariots de ménage et d'introduire un petit déjeuner en libre service constitué de produits locaux de saison et autant que possible issus de l'agriculture biologique. Afin de changer les pratiques et de s'approprier des soins plus éco-responsables et durables, il est nécessaire de rechercher des fournisseurs locaux si possible, avec des critères de durabilité et un impact carbone entre autres modéré. Ce travail nous a permis de trouver des fournisseurs de gel lavant pour le bain des bébés et de couches lavables à moins de 20 km de la maternité. Accompagner le changement pour le lavage écologique des sols avec la formation réalisée par le fournisseur et avec une réflexion institutionnelle sur les chariots de ménage. De trouver un fournisseur de pain bio s'intégrant dans les exigences d'une centrale d'achat pour la restauration. De changer les contenants alimentaires, comme les bols en plastique, par de la porcelaine, du verre ou de l'inox. De travailler avec les équipes de salles de naissance sur les kits de prélèvement au scalp pour les pH des fœtus et des nouveau-nés. D'entraîner les industriels du lait infantile vers un total changement et une refonte de leur chaîne de fabrication et de distribution pour fournir des mini-biberons en verre. Entre 2018 et 2022, nous avons pu bénéficier de financements pour nos consommables comme les gels lavants pour bébés sur tout le pôle, les couches lavables, des formations santé environnementale et sur des lignes financières spécifiques, les nettoyeurs vapeur, des formations aux achats responsables pour les managers du pôle femmes-mères-enfants avec les équipes des services économiques. Le travail réalisé par l'encadrement et les équipes, la communication soutenue par la direction et l'Agence régionale de santé de Nouvelle-Aquitaine ont permis une connaissance et une reconnaissance de ces bonnes pratiques et une sollicitation régulière pour les partager avec d'autres maternités en France et en Europe grâce à Born Green Generation. La communication à tous les niveaux et avec toutes les parties prenantes est un incontournable. Cette communication avec chacun doit être claire, ferme et définir les attentes en durabilité, écologie et en santé environnementale du service et du pôle. Il faut rechercher en interne des partenaires experts dans les différents domaines qui vont pouvoir proposer et structurer des actions en lien avec leur domaine de compétences et ils pourront ainsi accompagner le changement avec les équipes managériales et les professionnels de santé. Il faut mobiliser et souligner les valeurs partagées, soit la santé, les expositions des femmes enceintes et des nouveau-nés, la parentalité, la durabilité, l'écologie. Ce qui a convaincu les fournisseurs, c'est l'opportunité d'accéder à un marché innovant, tout en adoptant une approche respectueuse de la santé des générations futures et de l'environnement. Ils reconnaissent qu'un refus d'évolution pourrait entraîner une perte de part de marché, notamment pour les fabricants de lait infantile. Les initiatives menées au sein des maternités et des services de gynécologie obstétrique leur offrent une visibilité dans un cadre valorisant, tout en représentant une opportunité stratégique en termes de marketing. Les jeunes parents constituent une clientèle potentielle à long terme. Ces actions exemplaires permettent également aux fournisseurs de collaborer sur des communications valorisant ces démarches. Nous avons intégré les fournisseurs aux journées d'études des sages-femmes coordinatrices, où un thème lié à la santé environnementale ou à l'éco-conception des soins est abordé chaque année. Cette démarche, pérennisée depuis 3 ans, figure parmi les objectifs inscrits dans la charte de fonctionnement d'association. Les fournisseurs ont été également présents lors du lancement du Board Green Génération France, renforçant ainsi leur engagement et leur collaboration dans ces projets novateurs. De nombreux freins ont dû être dépassés, tels que la résistance au changement de pratique, en interne avec les professionnels de l'hôpital, mais aussi avec les fabricants de lait infantile. Les laboratoires de cosmétiques qui fournissaient très fréquemment des échantillons permettant de ne pas acheter de produits pour la toilette des nouveau-nés ou des femmes enceintes. Il a fallu repenser les contraintes logistiques pour limiter la pénibilité lors du stockage ou de la stérilisation. L'équipe d'hygiène, dont il faut saluer le travail, a eu des défis à relever en ce qui concerne les normes hospitalières très contraignantes en hygiène, mais grâce à l'accompagnement de primum non nocere, de l'expertise de comités d'hygiène régionaux et du partage de bonnes pratiques, certains freins ont pu être levés. Cela a été un travail long, une année en moyenne sur chaque action. Quand on s'engage dans un tel processus, il est impératif d'évaluer les pratiques et les produits utilisés, de déterminer les actions à fort impact susceptibles de générer une motivation significative en interne, de constituer une équipe projet qui inclut la direction, les responsables de pôle et des agents engagés, de collaborer avec d'autres établissements ayant déjà travaillé sur un même sujet pour partager les procédures. Ce travail doit s'accompagner d'une formalisation écrite et de procédures ou process permettant de les répliquer et de les transmettre aux autres professionnels dans d'autres établissements de santé qui souhaiteraient les mettre en place. Nous avons nous-mêmes bénéficié du travail fait par un autre établissement pour les soins de cordon au savon doux et cela nous a permis de supprimer la biseptine. Il faut identifier des fournisseurs réceptifs et déjà impliqués si c'est possible et instaurer un climat de confiance gagnant-gagnant. Initier des actions bien structurées avec des professionnels experts qui vont pouvoir amener des arguments techniques n'impactant pas le quotidien des professionnels dans les services, hygiène et lavage écologique des sols, désinfection à la vapeur. Assurer une communication efficace en interne et en externe, valorisant tous les professionnels impliqués via les réseaux sociaux, la presse et ou des sites environnementaux. En conclusion, je dirais que même si le parcours a été long, l'enrichissement a été à la hauteur des investissements humains mis en place. Il est possible d'adopter des soins éco-responsables et la Haute Autorité de santé française a intégré cette donnée dans la certification des établissements de santé, ce qui montre l'enjeu pour nous tous de faire diminuer l'impact des établissements de santé dans la durabilité et la survie de notre planète. Les conséquences en santé environnementale, en écologie, au niveau social et économique sont des enjeux réels pour le système de santé afin de permettre de pouvoir continuer à faire des soins de qualité tout en intégrant les données de prévention. J'espère que cet exposé permettra pour certains d'entre vous de mettre en œuvre des actions nouvelles favorisant la santé des générations futures et le devenir de notre planète, mais aussi d'avoir des arguments pour travailler avec les partenaires professionnels de santé, les services supports ou les fournisseurs à la mise en place d'actions innovantes qu'ils partageront eux-mêmes avec d'autres partenaires, ce qu'encourage le projet Born Green Generation. Merci pour votre écoute et bonne continuation dans ce partage d'expériences. Bonne journée.
Merci beaucoup, Dominique. As Dominique has not been able to join us today, if you do have any questions, feel free to message her via the direct messaging option here on Hublot. Alternatively, you can email the Born Green Generation team and we can connect you as well. And next, I'd like to welcome our next speaker, Annette Visgaard, also a Born Green Generation project manager at the Centre for Sustainable Hospitals in Region Midland, where she supports women's and children's services across 5 hospitals in central Denmark. With a background in strategic design, Annette is passionate about discovering user needs to steer stakeholder decisions making towards sustainable innovation. Annette, the floor is yours.
Thank you, Josephine, for that kind introduction. So today I will share some practical experience on conducting an inventory of product use and suppliers in order to identify high priority areas for phasing out toxic chemicals in neonatal intensive care. So just to let you know, we are region Denmark Central is we have 4 regions in Denmark. And in the slides, you can see that, I'm sorry, am I on? The screen has, okay, I don't know if I'm on, I'm going to continue. So central Denmark is the blue area with 1.3 million inhabitants, and the region employs 32 full-time staff. At Center for Sustainable Hospitals, we are 17 employed and work every day to promote sustainable transformation of healthcare system, ensure that decisions made today don't compromise healthcare future of tomorrow. So we are on a vision. We believe that babies should and can be born and treated in healthcare environments that are free from unnecessary and harmful plastic and toxic chemicals, so that they can develop healthy and thrive in a balanced ecosystem. You can say an important outcome of healthcare is a human biological disposed to be healthy from birth to old age. So looking at EDC's endocrine disruptive chemicals, on the list you'll find DEP, which is a phthalate. It's used to soften PVC, which is otherwise a rigid material. The problem with PVC is that after 24 hours, the chemicals in the PVC begins to leach. Phthalates and plasticizers are extensively used in medical devices or medical products, from which they can leach out and lead to potential multiple problems for patients. There are many different phthalates, and in the region we are working to eliminate 18 phthalates, and DEP is just one of them. So studies on exposures to plasticizers in neonatal units shows that medical devices used for respiratory support, IV therapy, nutrition, and transfusions are the main sources. The lower the birth weight and gestational age, the higher the exposure. So where do we start? Which products should we focus on and prioritize? So before Born Green Generation, the project, the Central Denmark region didn't have a business process, method or policy that addressed the chemical content of medical products specific for neonatal intensive care. There's established procurement procedures for focus on phasing out EU-listed chemicals during a tender process, but that effort mainly target large-scale purchases, high-volume items. And in a region with 5 hospitals, neonatal intensive care aren't the biggest consumer of products compared to surgical department. So the items used in neonatal intensive care are often smaller procurement agreements, and they have been traditionally handled differently because the children are most vulnerable patients and should have the best products. So you can say prior to the project, there seemed to be kind of religion or even fear of overstepping from the procurement side when it came to demanding specific standards for these products. Today, however, we know more. We understand that the best products aren't just about high performance and functionality. They also support the children's long-term health and future well-being. Also, to add to the complexity, the 5 hospitals can purchase the same product from different suppliers. And in total, there are more than 1,000 plus numbers registered for neonatal units alone, classified as medical products. So really, where do we start? So firstly, we start with acknowledging there is a problem. And based on the precautionary approach, we start identify high priority areas for phasing out toxic chemicals in medical products. Our approach to conduct an inventory of product use and suppliers is based on mixed methods. First step, we ask the staff that what product they used. Secondly, we did a data extraction, identified the top 100 volume products. And thirdly, we constructed a hypothetical scenario interviewing staff. After each action, we conducted data qualification, refining the product use with hospital staff. Then we had a dialogue with the staff about the products they used in practical. This hands-on setting helped us generate both information and insight about how the product actually been used. It's a very pragmatic approach, and the conversation helped us develop a shared language around the children's different points of contact with medical devices. Which ones are used briefly, which ones are used more continuously to meet basic needs in medical care. Besides creating learnings about product use, we also could physically see the products and identify those that contain large volume of plastic, for example. Finally, the discussion gave staff an opportunity to reflect on how they use medical products, sparking that first awareness of circular economy principles, especially in relation to clinical consumption. Bringing these insights and learning into our hospital partner meeting in the Born Green Generation project really helped us categorize the product use in neonatal intensive care. Here you can see our prototype, and honestly, knowing this categorization probably would have saved us time and effort figuring out where to start. Also, we tried to create a framework to guide prioritization and support dialogue on topic. It went through many prototypes, and in the process helped us better understand the challenges of phasing out toxic chemicals in neonatal care. As you can see, there's 3 levels of direct impact. Level 1 with direct impact is where there's an impact from the environment surrounding the baby. Direct impact can be contact with blood vessel veins, and it can be from a stay up to several days. Direct 2 is short impact, skin moss membrane, and level 3 is indirect impact. And the 4th level, we decided not to continue. The 4th level is environmental impact, but we choose to exclude this of influence because the product category, mostly cleaning products, for example, already have established government within the organization, including clear responsibility and procedures ensuring that products do not contain EDCs. So instead, we prioritize focusing on medical problems that children comes into contact with during hospital care. And finally, inspired by the Norwegian eco-labeling analysis worksheet, we are working in a working process and currently are finalizing an analyzed basis based on data from the suppliers. However, from our first desk research, we can see that some interesting results on the content on the product. For example, the gastrogastric feeding tube is a very small tube which must be very flexible and narrow. And you can say if this product can be produced without tallets, then other tubes used in medical care should as well. So these findings clarify opportunities for setting standards for EDCs because there are already products in the market meeting these requirements. And here's some of our practical experience to how to identify high priority areas, focusing on PVC and interrupting chemicals. Thank you.
Thank you, Annette. A great demonstration there of linking the products, the risks of EDCs to actually providing clinical care. Thank you very much. For our final presentation, it is my pleasure to introduce Fiona Adshead, Chair of the Sustainable Healthcare Coalition in the UK. Fiona is a wellbeing and public health leader experienced in reframing thinking and developing innovative strategies. Her previous roles include Deputy Chief Medical Officer and Director General in the UK Government, Director of Chronic Disease and Health Promotion at the World Health Organization, and Bupa's Chief Wellbeing Officer. Welcome, Fiona, and the floor is yours.
Thanks very much, Josephine. And perhaps if we move on to the next slide. So I'm going to continue the conversation to think about how we as an organisation, the Sustainable Healthcare Coalition, have worked on understanding impact and have worked with the supply chain. We were formed by the NHS in England precisely because it wanted to bring together a coalition of its supply chain, because it recognised that 2/3 of its impact was with its supply chain. But the burning question was how to measure impact. If we could have the next slide. So what we've done is, in our first approach, was to measure and come up with a method of how you measure the impact of products. And we came up with the first greenhouse gas protocol of how you measure medicines and devices. But we then went on, if I could have my next slide, to measure the impact of care pathways. And the way in which we've done that is to look at an activity-based analysis where we look at each step in the process and add those up. And all that information, that guidance and that approach is available on our website. So if I could have the next slide on the vision of value. I think there's a time lag. That's great. And then the next slide. At the heart of this really is, how do we define value? In healthcare systems, we have for years looked at how do we maximise health outcomes whilst minimising cost. And that's what health technology agencies who look at how we reimburse care focus on. What we've argued in a recent paper is that that definition of value now needs to include environment. And we need to think about that whilst continuing to put health outcomes first. So if I could have the next slide, please. What we've done as part of this conversation is really emphasise the fact that we need to see this across the whole system of the care pathway. If I could have the next slide. Not only looking at the individual interventions and their footprint, important though that is, but also to look at the whole care pathway system and how those interventions impact the outcomes and patient experience at a system level. So if I could have the next slide, please. So what I want to do is describe two ways in which this care pathway approach can be applied to really understand impact. The first is when we look at a new intervention. So here with the Health Innovation Network in Oxford, we looked at a novel diagnostic which enables hospitals to identify women at risk of preeclampsia. And what that means in practice is that they don't have to spend so much time in hospital, and that improves their experience. And this analysis really shows how we mapped out care, how we showed that this new diagnostic reduced the amount of time women spent in hospital, reduced their travel, reduced cost, but really importantly, improved the environmental impact. So that's how you apply it to a new intervention, and that's really how you can have a different conversation with service providers around the value that their products bring. Next slide, please. We then adapted and adopted this approach in some work that we did together with Josephine and others with the Centre for Sustainable Healthcare, the Royal College of Obstetricians and Gynecologists and the Royal College of Midwives, to look over a 2-year period how we could map out healthcare to understand the carbon hotspots, areas of inequality, but also work with teams to really look at maternity challenges they had, and very importantly, looked at the lived experience of women so that we could bring together what clinicians cared about in terms of their care, women's experience, and then partner with industry to think about innovative approaches. So if I could have my next slide, please. So what you see here is a maternity care pathway mapped out with the red lines identifying what's in scope. And without going into all the details, really there are two examples. one of the green challenges identified that monitoring women at home for hypertension would be a good idea, and that actually, as you can perhaps see, travel was a big issue. So that was an example of how we could design care to improve women's experience, but also reduce environmental impact. And the second was perhaps a slightly knottier issue around when women are giving birth, around what are the biggest contributions. And within that, what we noticed is that, in fact, gases that women have at the time of birth have a big impact. So that raises a question about how can we think differently about working with industry and with service providers around this. And that's where, if we could move on to the next slide, we were talking about this issue of servitization, which Josephine mentioned. And what is servitization? Well, essentially, it's about shifting from buying things, products or services, to really buying values and outcome. So what is it you are buying? What's the outcome that you want to achieve? So this is actually a common approach in other sectors. So if we look at aviation, Rolls-Royce, who's a big engine producer for aircraft, have this mechanism called power by the hour. And what it means in practice is that airlines pay for the usage of the engines on an hourly basis. For them, it means that they don't have to become experts in engine maintenance. That's the problem of Rolls-Royce, but they do get a really good service, and it incentivizes the producer Rolls-Royce to make sure their engines are really working well. And at the heart of it, the airline can focus on their core business, which is flying people and providing a good customer experience. So this, perhaps if we could just go back. So this issue of servitization could be applied to healthcare. So if we looked at Entonox, nitrous oxide, and this is just an example, we have some choices. We could choose, if we think it's impactful, not to use it. That might not be what we want to do. We could intervene in the kit itself by disconnecting delivery valves when it's not in use. We could remove that system altogether by looking at canister delivery at the bedside. But we could also think about, could we put this problem onto the product provider by asking them to provide a service of buying hours of pain relief, not a gas. So that's the idea behind it. Then if I could move on to the next slide, please. As Dominique described, there is also, I think, an emerging approach of clinicians working together to really think about what do they want to get out of procurement. And this is an example from the world of kidney care, where the International Society of Nephrology, through its Green K initiative, driven by clinicians, are working together to really think in procurement, what is it they need from manufacturers and service providers to really reduce the impact of hemodialysis, peritoneal dialysis, and really challenge them through a joint statement of demand to come up with different products and services to really support them in greening care. And that's exactly the kind of approach we were hearing from Dominique. And it's very powerful because it's changing the conversation. So if I could have my final slide, please. So at the heart of this, as Josephine was suggesting at the beginning, we need to shift the conversation so that women who are experiencing the service, providers, clinicians who are delivering it every day, procurers and product providers are brought together to have different conversations, to look at different models like servitization, different approaches like responding to joint statements of demand based on a really good understanding, as Dominique was saying, of the service and what it needs. And obviously looking at novel ways to reduce impact, as we heard from Annette. So if I could have my final slide. That's the kind of work we do at the Sustainable Healthcare Coalition. We work in collaboration. And Josephine, it's a pleasure to hand back to you, and thank you for convening us all for this session.
Thank you very much, Fiona, and it was a pleasure to hear more detail about the service and the thinking behind that switch to service-based procurement as well. And thank you to all of our speakers for sharing their really inspiring work and execution as well. So now I'd like to open up the discussion as well. So please, if anyone viewing has any questions, feel free to add them either in the chat or the Q&A box. We have got a couple. First one from Naveen. I think this is aimed to yourself, Fiona. Does any supplier qualify for these requirements?
It doesn't quite work like that at the moment, but it might be worth looking at the work that is happening as part of the Sustainable Markets Initiative, where it's a coalition brought together by our King. We have a health systems task force, and there a number of companies have set supplier standards, so it's their own supply chain, which they themselves are adhering to, and they want their own supply chains to work to. Within clinical trials, we're looking at what are the targets we want to set to decarbonise clinical trials and how do we set those. So we're in the process of looking what those KPIs would be, and companies are already doing that with their supply chain. So Naveen, that might be something that you could have a look at. But often there's not an answer of a number. So often what you're looking at, like in the maternity care pathway, is a hotspot. And then the question is, how do you deep dive into that to understand more? And so the KPI probably is, how do you work further to decarbonise it as a process? And that question about what the target would be is the hot topic, I guess, and that's why health technology assessors and others are beginning to think about how do they come up with the values that include environment so that we can start making choices based perhaps more on decisions and numbers and metrics.
Thank you for that, Fiona. I think there was also a follow-up question from Naveen about KPIs, and I think you've kind of integrated the answer to that as well. So thank you very much. Our second question is from Rosario. What were the main challenges you faced while implementing green solutions into maternity and paediatric wards? I will put this one to you, Annette, please.
Currently, I think it's matters of hygiene, scaling ideas from one hospital to the other. In terms of hygiene, is actually currently one of our challenges.
And
yeah, please go ahead. Yeah.
So I think for me, one of the challenge is that applying this care pathways approach and looking at impact is relatively new in maternity care. So we were all learning together as to where the impacts are. When you've done that, there is no shortage of fantastic ideas that we saw in the maternity challenge of teams wanting to come up with solutions. And so working with them to build skills and capability to reduce impact was important. And I think, as we heard earlier from Dominique, working together with industry in a new way is always a challenge, just because we're learning to have different conversations. And that's one thing I think that we can get better at doing. But so it was great to see the progress they've made in France.
Lovely, thank you. We have another question from, I think it's pronounced Giske. Apologies if I have mispronounced that. This one's for Annette as well. Could you please elaborate a bit on why you did not include the environmental impact?
Yes, because we work mainly in environmental impact in the region Midtjylland. All our actions are measured in CO2. So actually to be talking about health effects is new, and we need to make that bridge on how climate and environmental impact is affecting healthcare. So maybe a misunderstanding. Maybe you are talking into the number 4, the environmental impact, in our model. If that is maybe what your point of the question is.
I think so as well. Yeah.
Okay. Thank you. So what we are looking at, these circles you have to imagine the child is physically in the center in a room, and the environment here could be the room, the maternity ward, and most of the inventory, the beds, paints and ceilings, requirement for not containing EDCs, etc., is already taken care of somewhere else in the organization. So we would like to focus on the products that is closely contact and to the baby, things that is medical products that is more difficult to change because the market is not ready or is not demanding, hospitals are not demanding these products. And the regulation for medical products is not as good as consumer products, you can say. So we have much more unwanted chemicals in medical products, unlikely paint, for example, for the walls. So to not include environmental impact it gives us a higher level of innovation and change, and it makes us focus on new products which normally is not targeted for change. Does that reply to your question?
Yeah, thank you so much. I think as well, just for the wider Born Green generation, the two focuses of it, as you said, is reducing that exposure of chemicals, and those within that model, that environmental aspect is more about things, as you said, in the room, not in direct contact with the infant as well. And there is, for the audience as well, there is much more details about that within our recently published Why and How Born Green Generation document. So we can add a link to that in the chat momentarily as well. Excuse me as well. Fiona, another question from myself as well, and it reflects slightly a comment in the chat as well. Where might people start if they're interested in starting applying a care pathway approach?
Yeah, that's a really good question. I mean, our website has the information you need on our Knowledge Hub. It includes a step-by-step approach. You don't need to have any knowledge at all to use our calculator. If you don't have the information about your own service, you can we have defaults in there which will help you do a rough and ready calculation for your service. So that's a good starting point. And we're going to soon be featuring some videos which our fellow Rose Ingleton produced recently, really taking people through it step by step from a clinician's point of view, because she's a surgeon. And I think the key thing is everybody ought to be able to use this on an easy fashion to start to experiment and ask those what if questions, because we don't need to be environmental experts. That's the point of these kind of tools, is trying to really simplify it so that anybody can get an idea, begin to understand where those hotspots are, as we did, Josephine, in terms of that broader work, and then use that to understand how they can innovate.
Thank you so much. So we've come to the end of this session. Once again, I would like to extend my thanks to our speakers for participating in this session and sharing some really inspiring examples of changes made within maternity and paediatric settings. And thank you to you all for joining us today. We encourage you to continue the conversation in the chat or connect directly with our speakers and fellow attendees via the platform. Coming up next at CleanMed Europe, we have the workshop, A Care Pathways Approach to Sustainability, Why It Matters and How You Can Apply It in Practice, which will begin at 3 p.m. Central European Summer Time. I'd also like to highlight another session we have coming up. Don't miss Sustainable Approaches to Safer Maternity and Early Care Life on Friday at 1:30 Central European Summer Time, and that features 2 more of the Born Green Generation clinical partners. And as well, Moving Away from PFZ, Why It's Necessary and How It's Achievable, also on Friday at 5 p.m. CEST. Thank you again, and we hope you enjoy the rest of CleanMed Europe 2025.